Hey, good evening, everyone. I am Yansha Li. I'm a pathologist based in Chicago area. I will be your host for tonight's lecture. Since we may have some English-speaking audience today, so this lecture will be conducted in both English and Chinese. We will begin in English and then continue with discussion in Chinese. So welcome to Alliance of North American Chinese Physicians, or ANACP, founded in 2016. ANACP is a nonprofit organization committed to promote collaboration among Chinese physicians in North America. We also work closely with other medical specialty societies and local physician groups to strengthen our professional network and educational opportunities. This is our website on the homepage where you can find updates on our current activities and upcoming lectures. Over the years, we have hosted a wide range of lectures for both physicians and general public. In addition, our bi-monthly journal as a voice of an ACP or VOA, including research articles, personal stories, and youth volunteer contributions. Is all in this journal. So you all are welcome to the website and browse all these journals. And also, this year marks a special landmark, a milestone of our society is our 10th anniversary. And we're having our annual meeting in Dallas next month to celebrate our decade of growth, friendship, and collaboration. And in our lecture page, we have all these past lectures listed on our website. You will be able to go to check out our lectures. And this lecture, after it's done, will be listed on this website as well. All right, and we have CME lectures for our NACP physician members, which you will be able to log in to see the videos as well. All right, so next, I am going to introduce our three speakers today. So our first speaker will be Dr. Brenda Wu. All right. And Dr. Brenda Wu is a distinguished neurologist with over 20 years of experience, specializing in epilepsy, neuropsychiatric disorders, and integrative brain-body wellness. She completed fellowship training in clinical neurophysiology and epilepsy at Yale University and University of Florida Brain Institute, and holds a PhD in pharmacology and neuroscience from Albany Medical College. Dr. Wu focuses on connection between neurological functions, emotional health, and physical vitality. Her clinical work spans the diagnosis and treatment of complex brain disorders, including epilepsy, dementia, mood instability, and post-COVID neurological symptoms, including the personalized, lifestyle-centered approach. As a founder of NG Neurocare, Dr. Wu developed the UltraSculpt program, integrating non-invasive fat reduction and skin tightening with comprehensive neurological and metabolic care. The program provides customized nutrition and lifestyle plans for each patient. In this lecture, Dr. Wu will discuss how combining aesthetic and lifestyle intervention can enhance longevity, mental clarity, and skin health. Her approach bridges traditional neurology with modern anti-aging science, offering a holistic framework for sustainable wealth and graceful aging. Our second speaker for today is Dr. Joanne Jiang. Dr. Jiang is a scientist, entrepreneur, and leader in the wellness innovation. She earned her PhD in pharmacology from Indiana University School of Medicine and has over 20 years of experience in global pharma and clinical research. Dr. Jiang is a founder and CEO of LeaderMed and UltraSculpt, where she pioneered a patented ultrasound technology for non-invasive fat reduction and skin tightening. Now trusted by luxury spas worldwide, she also leads the development of breakthrough obesity and diabetes therapy in Asia. Her vision is simple yet powerful to bring science, longevity, and beauty together, helping people look younger and live healthier. All right, now it comes to our third speaker of the day is Grace Chen. She is the Chief Commercial Officer at UltraSculpt. She leads the client services, partnering with surgeons, doctors, med spas nationwide to ensure excellent results for patient and profitability for clinics. With a background in public health from Johns Hopkins and an MBA from Stanford, Grace also brings experience working with many physicians transitioning into concierge medicine, giving her a unique perspective on how UltraSculpt fits into modern practice. Now, let's welcome Dr. Brenda Wu and Dr. Jiang and Grace for their talk. Now I'm gonna share the presentation of their talk.
Thanks for having me. It's great to be part of this conversation on such a fantastic topic. I'm honest, I have to be honest, dermatology isn't my specialty, so I won't pretend to know my way around a protractor. But as a neurologist, I've been diving into how skin health, immune function, and brain health are all connected. Today, I'll share some insights from that journey, what I have learned, what I'm still figuring out, and why this intersection of systems is more exciting than it gets credit for. Okay, so there are many factors that affect skin health. Some we inherit, others we encounter. Biological factors like age, gender, and genetics play a foundational role. Environmental influences such as sun exposure, climate, and pollution also leave their mark. And lifestyle choices from beauty routines and emotional well-being to sleep, nutrition, and exercise can either support our skin's resilience. Next. Okay. A healthy skin lifestyle includes protecting our skin from sun exposure, eating a balanced diet rich in antioxidants, staying well hydrated, getting enough sleep, managing stress, and avoiding smoking and excessive alcohol. Other key habits like gentle cleansing, regular exercise to boost circulation, and daily use of broad-spectrum sunscreen also play a vital role in keeping our skin resilient and radiant. Let's not forget your skin is a reflection of your internal health. So while serums and creams have their place, don't underestimate the power of a good night's sleep and a leafy green salad. Your skin will thank you, even if it cannot say it out loudly. So human skin serves as a major tissue for hosting diverse microbiome communities. Factors like body mass index, BMI, can influence both the skin and the gut microbiomes. Psychological stress and anxiety can disrupt gut microflora, increasing intestinal permeability and contributing to systemic inflammation, often seen in individuals with acne-prone skin. Both probiotics and antimicrobials may play a role at the gut level, potentially improving skin appearance and leading to positive effects on self-perception, confidence, and even how others perceive us. Poor skin conditions can trigger local inflammation and elevate systemic cytokine levels. In contrast, maintaining good skin health helps regulate the body overall inflammatory status, supporting internal wellness from the outside in. Next, hormones have a direct and significant impact on skin health. For example, declining estrogen level with age can reduce skin thickness, collagen production, and moisture retention, leading to dryness, thinning, and decreased elasticity. Androgens, including testosterone and progesterone, stimulate sebum production, which may result in an oily complexion and acne. Elevated cortisol levels due to stress can cause facial puffiness, sometimes referred to as moon face, and contribute to systemic inflammation. Hormonal imbalances also affect skin moisture. Low levels can lead to dryness, while high levels may cause excessive oiliness. Additionally, the natural decline of growth hormone with age contributes to reduced skin thickness and elasticity over time. So next, hormonal imbalance can contribute to a wide range of skin disorders. Acne, for instance, is often linked to fluctuations in estrogen, progesterone, and testosterone, which influence sebum production and inflammation. Low estrogen levels can impair the skin's moisture barrier, leading to dehydration, dryness, and increased sensitivity. Additionally, hormonal shifts can trigger inflammatory skin conditions such as dermatitis, making the skin more reactive and prone to irritation. Next, mitochondria play a vital role in regulating key functions within skin cells, including keratinocytes and fibroblasts and melanocytes. Mitochondrial dysfunction has been linked to several skin conditions such as psoriasis, atopic dermatitis, and vitiligo. It is also a primary driver of skin aging, contributing to visible signs like wrinkles, uneven pigmentation, and slower wound healing. Stress, whether environmental or physiological, can impair mitochondrial health, leading to skin inflammation and damage. Alterations in mitochondrial DNA biogenesis and dynamics compromise skin cell function. Unlike nuclear DNA, mitochondrial DNA lacks protective histone proteins and has less efficient repair mechanisms, making it highly vulnerable to oxidative stress. This damage reduces energy production, further weakening skin resilience. Restoring mitochondrial function offers promising strategies for treating skin disease and slowing the aging process. By improving mitochondrial health, we may enhance skin cell performance, reduce inflammation, and support overall skin vitality from the cellular level. Next, telomeres are protective caps at the ends of chromosomes that shortening with each cell division. Over time, this shortening contributes to aging and reduced cell function. In the brain, telomere shortening is linked to age-related decline, making telomeres a key marker of cellular aging. Next. Compared to youthful skin, aged skin tends to be thinner and drier. The epidermal layer becomes more fragile, fat and hair distribution shifts, and the dermal layer thins. Sweat and oil secretion decline. Blood supply decreases, and visible signs such as age spots, uneven tones, wrinkles, and redness become more prominent. Anti-aging strategies for skin include consistent sun protection, a healthy diet, proper hydration, quality sleep, stress management, avoiding smoking, and limiting alcohol intake. Good skincare practices such as gentle cleansing, regular exercise, targeted nutrition also play a key role. Nutrients like vitamin C, E, B3, omega-3 fatty acid, CoQ10, NAD+, or support skin health at the cellular level. While lifestyles and topical care are essential, professional treatments may deliver more noticeable results in a short time frame. Next. Exercise is well known for its positive neurophysiological and neurochemical effects, and it also offers powerful benefits for skin health. The top 5 benefits include improved blood flow, enhances delivery of oxygen and nutrients to skin cells, supporting regeneration and repair. Detoxification boosts circulation and lymphatic drainage, helping remove toxins from the skin. Anti-aging effects promotes collagen production and cellular turnover, helping prevent and reverse signs of aging. Stress reduction lowers cortisol levels, which can reduce inflammation and improve skin clarity. Better outcomes for chronic skin conditions. Regular exercise may help manage conditions like acne, eczema, and psoriasis by improving immune response and reducing flare-up. Next, by decoding skin aging, we identified key factors that influence skin health, both intrinsic and extrinsic. Intrinsic aging includes telomere shortening, oxidative stress, hormonal decline, and autophagy dysfunction, all of which contribute to fine wrinkles, dryness, and reduced elasticity. Extrinsic aging is driven by environmental exposure such as UV radiation, smoking, pollution, and poor diet, leading to deeper wrinkles and uneven pigmentation. To address these aging mechanisms, especially mitochondrial dysfunction and cellular repair, several advanced medical treatments are emerging. So I'll give Dr. Joanne Jiang to talk further about novel technology for skin treatment.
Thank you, Dr. Brenda. It's such an exciting moment to join this webinar upon invitation by ANACP. Thank you, Dr. Lee, for hosting, and thank you, Dr. Brenda Wu, for all the strong academic knowledge sharing for skin health. So as a scientist, I have always been focusing on fat reduction and skin tightening for 25 years of research. So my observation is whenever people lose weight, or because of aging, everybody has a little bit of loose skin at one part or multiple parts of the body or face or neck. So as a researcher, 7 years ago, our team focused on trying to invent a device which is not so much pharmaceutical use, but we want to use a non-drug approach that's non-invasively address the skin laxity issue. About 9 million or more Americans nowadays are on some type of weight loss drugs, And as some people already achieved very good weight loss, they're also left with extra skin, which so far has no solution other than UltraSculpt or surgery. But surgery is such a painful and risky and time-consuming approach. So that's why we invented UltraSculpt. If you look at our device demo right here in the right-hand corner picture, you can see we have a transducer that would produce the patented sound wave in the low ultrasound range, which is very unique. No one in the world right now, besides us, are using this particular sound wave. So the frequency has been patented by my company, UltraSculpt, and we're located in Princeton, New Jersey. So we welcome all the doctors to contact us through our email or our website, so that we want to extend this technology to work with all the doctors out there that are helping their patients to feel younger and have tighter skin. So later on with this lecture, we meant to be more interactive. So in about 10 minutes down the road, we'll have a chance to vote on skin laxity, just like a doctor will. So it'll be a fun interactive exercise. So basically my invention are focusing on two aspects. One is the device that can create this skin tightening and fat reduction effect shown on the left. And the other one of my invention are focusing on the collagen enhancing microRNA. And everyone knows microRNA is a very short RNA molecule in our cells, which scientists 10 years ago was thinking that it's garbage because they're so short. They're like 10 to 20 base pairs. And as human cells, we only have like over 100 different variety. But sure enough, back in 2024, Nobel Prize was awarded to the two professors that discovered that microRNA does regulate our protein translation in our cells. So right now we are showcasing our microRNA-infused cream and serum as part of the UltraSculpt technology. So we're a microRNA collagen boosting in combination of the unique ultrasound wave treatment. And then the effect, as illustrated on the left, you can see this lady after 30 minutes of one treatment. She's already lost 3 centimeters on the upper ab, and then about 2.3 centimeters in the middle ab, and then again another 3 centimeters in the lower ab. So this is only 30 minutes, and then it's non-invasive, so there's no pain. So usually clients just lie down and enjoy the treatment of 30 minutes, and when they get up afterwards, they see much tighter and less fat in their area of treatment. So this is a grand technology where it fits everyone's desire these days. Like people just want to receive very beautiful results and also anti-aging effects without downtime and no pain. Next slide, please. So this demonstration is one of my training video for UltraSculpt specialists, where we show how to apply this technology not only for ab or thigh or buttock area, but also most importantly for the face and neck lifting, because that is the first area people notice. Like Dr. Brenda Wu was sharing with everyone that our face laxity unfortunately happens when we lose weight or when we age, and it's also tied into our whole body metabolic health and physiology and our neuroscience health, all tied up together. If our brain is not healthy, then our skin won't be healthy. If our metabolic system is not healthy, like our glucose metabolism or our hormonal balance is not healthy, then unfortunately our skin is not healthy. So having really healthy skin is not only just for you to look beautiful in the skin part, but also it reflects the youthful appearance and the general health status of you as a holistic approach and holistic subject. So I'm going to let Dr. Lee play this video to show you how we use this device to tighten people's skin. So basically, you just want to go around her, not stopping too much in one area, but rather evenly distribute the energy right at the edge of her scalp, her hairline. Yes. So as you can see, we don't need to really treat on the face. Our lifting is created by gently stimulating the tendons. We know from anatomy, our classes, we were taught that human face are found on our skull using multiple tendons right around here, and then like in front of the ear and behind the ears. So that's exactly how plastic surgeons, when they do a surgery-based facelift, work on, is to shorten those tendons. But now we're exactly reproducing that facelift non-invasively. So our ultrasound head are reaching the fascia layer, which is about 6 millimeter underneath the skin. And then when we do it on the face and neck and chin area, we're not doing fat reduction. Our energy level is lower that we're using here so that we can only shorten the tendons. So when we were born, our tendons are really short. When we're young, our tendons are really short. But as gravity pulls, our tendons, there's like elastic bands are being pulled down. So, and also whenever we gain weight, people start to form double chin, then the tendons around here and here are unfortunately stretched. So when we lose weight, we're left with like a lot of skin laxity, or when we age, we have like lines on our neck, and then our chin becomes kind of not clear, like the jawline and our apple cheek are pretty much the prime area where people notice, oh, you know, like I appear older, like I lost weight, but I look in the mirror, I look 20 years older than before. That's usually what I hear from clients and patients that really seek help in tightening their skin. So next slide, please. So then this is the before and after one treatment that you just saw when I delivered that training on this particular team lady. And she's really enjoying the treatment. It's like sleeping. Usually people fall in sleep during the treatment. And then when she wakes up, you can see that her eyebrow and eyes, unfortunately, because of the confidentiality, we're blocking her eyes, but you can see like her eye bag area, which was very obvious before the treatment. Now you see after even just one treatment of half an hour, her eye bag is much smaller and her eyebrow are raised, and then her wrinkle in the nasolabial fold area and two sides of her mouth have significantly been reduced. So when she received multiple treatments, she'll even have a much younger appearance, about 10 to 20 years younger. So if you look at the side view, the way to tell her jawline is to look at the shadow. And before, the shadow were like unclear. And then afterwards, you can start to see a pretty clear jawline, which means if she takes a selfie or she posts her vacation photos, she'll appear much younger and much lively. So basically, I'm very happy that my invention is giving a lot of ladies and guys high confidence. So it doesn't matter if they're continuing their business function, or they're just enjoying themselves in events, cocktail parties, or vacationing, then everyone is quite happy of their appearance. So next slide, please. So we're running short on time. So to leave some times where we talk about concierge medicine, which I heard is one of the main topic that a lot of doctors are interested in nowadays. Before that, we can just show you our 230 patients clinical trial that we conducted in US for UltraSculpt, where we sculpted, tightened the chin and neck, the arms, abs and back and hips and thighs of 230 subjects. And with our microRNA cream and serum application, and each 30-minute of session, we measured after treatment, and we found that statistically, we're producing a very significant dimension reduction, about 3 to 4 centimeter per session. And then also some people reached 6 to 7 centimeter in localized areas. And then we also have continued skin tightening and fat loss, even up to 3 to 7 days after each treatment. And we also followed up on safety for up to 6 months to 12 months after the treatment, and everyone has not had any adverse events. So we measured the skin tightness by asking very objectively blinded data from dermatologists in US, which are leading dermatologists such as Dr. Amy Lewis in New York and famous Dr. Richard Goldfarb, who is the founder of US Aesthetics Medicine Foundation and chairman. And we all got very significant skin tightening scores, very good effects from UltraSculpt treatments. So next slide. So here are all the results from one treatment. As you can see, even with like very aged, sun-damaged skin like this lady is showing on her arm, she's in her 70s. After one 30-minute treatment, she's already having a tighter arm, and the crease has been significantly reduced. And then on the other 3 graphics, you can see for ab, and then also for the side, the contour, and also the butt lift has been reached using our UltraSculpt. So this is a device that can, using one device plus our cream and serum, address pretty much all your people or clients' needs on skin tightening and fat reduction. Next slide. So this is a very key slide for tonight because our theme is longevity. So I'm sure as doctors and healthcare workers, all of you have friends and patients always asking you like how to stay young, how to improve quality of life. So based on what Dr. Wu and I share tonight, I hope we're giving you some ideas. And I also want to emphasize that we do have publications showing that when subjects receive 6 to 8 UltraSculpt treatments within a couple months, they actually rejuvenate the cells. So we do have a longevity advantage, and the telomere length has been regrown after multiple UltraSculpt treatments. So it is very meaningful to have this in your practice and to also recommend your clients to get multiple treatments to get the anti-aging effect. Next slide. So, okay, I'll give the podium to Grace. And Grace, you want to share your insights on public health and the wellness market?
Yeah, happy to. Thanks, Joanne. And thanks, Dr. Lee, for hosting, Dr. Brenda for sharing her insights as well. I'm really happy to be here with everyone today. My name is Grace, and I lead client services here at UltraSculpt. So it's my pleasure to work with some of the top doctors here in the US to make sure that they have very happy clients using UltraSculpt and, of course, high profits. So if we go to the next slide, I want to share with you guys today something that has come up over and over again with my doctor clients, and it's really focused on the idea of concierge medicine. And so what we've seen in the market now is a shift from sick care, which is more focused on disease treatment, towards healthcare or overall wellness and holistic wellness. So this is, instead of being a reactive treating things reactively. We're now thinking about things more proactively. And the reason a lot of doctors I work with are thinking along these lines is because the wellness market is just absolutely massive. So if we look at the statistics right there in the middle, it shows the wellness market is actually 1,000 times larger than traditional healthcare. And that's really because wellness can encompass so many different things. I mean, we have Dr. Brenda, who is a really distinguished neurologist who wanted to start offering UltraSculpt because she recognizes that it is part of a larger wellness trend. And I'm sure many of the doctors here today on the call have expertise in the areas that you see here on the slide: fitness, aesthetics, longevity, mental health, lifestyle, etc. And really, I also want to help our doctor clients capture those top 10% of Americans who are already spending $2,000 a month on their wellness and skin and anti-aging services. So this is in addition to whatever their insurance covers. This $2,000 is actually part of the cash pay market. And a lot of doctors will actually bring on UltraSculpt to help them capture some of those $2,000 that people are spending. So if we go to the next slide, I want to share with you why exactly doctors want to work with UltraSculpt and how it serves their transition from more traditional medicine into concierge medicine. So in traditional medicine, we know it's often a struggle that you have very short appointments with your clients, and you're not able to give them the holistic care that they're looking for. And I know you, as a very responsible and experienced doctor, wish you could give all of your clients. With UltraSculpt, however, because we are looking at a cash pay model where individual treatments can be anywhere from $800 upwards to even $1,500, you actually can spend a significant amount of time with only one patient and give them more of a holistic consultation. And so your patient will appreciate that extra time, that face-to-face time with you and learning from your expertise. And then you can also give the patient a better consultation. And so this is how, even with UltraSculpt, you can start to move towards concierge medicine, where the amount that you can charge with UltraSculpt affords you the time to spend that extra time with your client. Beyond that, using UltraSculpt actually positions you as a leader in anti-aging and longevity. Currently, we have heard lots of reports where the top 10% of Americans by 2030 will actually be living to age 130. That is because they have access to the best longevity and anti-aging solutions, including UltraSculpt. We are pretty much the most innovative device when it comes to not just fat reduction and skin tightening. I mean, everybody wants to look slimmer and tighter, but what really makes us innovative is what Joanne was just talking about, which is applying low frequency ultrasound on a repeated basis. We recommend about one treatment per week for 6 to 8 weeks, can actually rejuvenate your senescent cells. And this is really a buzzword that I've seen from clients just working in the aesthetics and wellness space. They're always like, oh, my senescent cells. So this is exactly something you can speak to with UltraSculpt. And you can also tell them about how using UltraSculpt increases your telomere length as well as mitochondrial activity, which are all key signs of anti-aging. So with UltraSculpt, you can actually start to position your practice as a luxury wellness service, and this will elevate both your offerings and your status, and can also capture quite a good clientele for you. So maybe the next slide. Yeah, here we have actually a testimonial from a client who was very scared of needles and surgery. So she was not willing to do other aesthetic treatments, but when she heard that her doctor had UltraSculpt, she actually came in and was really excited to experience it. So if Dr. Lee, you don't mind playing the video, we'll have Jana share her experience.
Hi, my name is Jana, and today I was just getting this new treatment called UltraSculpt done on my face, and I feel super cool. It tightened my skin. I felt very confident. I love how tight I feel. I really highly recommend. I definitely got the serum to continue with my treatment, and I just love it.
Awesome. So yeah, we have tons and tons of stories just like that. And maybe on the next slide. I want to invite all of you to join us in Dallas. So I know there is a health fair hosted by ANACP, their 10th annual, very exciting, happening October 17th and 18th. So shout out to them and the organizing team for putting together such a wonderful event and inviting UltraSculpt to be there. So for those of you who will be there, we encourage you to scan the QR code here on the screen. It will lead you to an RSVP form where you can actually get a demo treatment of UltraSculpt on yourself. So we've done nearly 10,000 patient treatments at this point, and I can say with my heart, every client and every treatment area sees beautiful results, and we're so excited to show you guys and bring that to you guys. So please scan the QR code, and we hope to see you in Dallas. And if anyone has any questions, feel free to shout them out. Yeah, and here we just have some examples of fat reduction as well as skin tightening, actually both on the face. So some people have excess fat underneath the chin, which we can get rid of using UltraSculpt, but then others don't have as much fat, but they do have some jowling and some looseness on the skin, which is a natural part of aging, but what many people want to get rid of. So here we have some recommended protocols of how we treated these clients. It's usually about 3 treatments will give them the best results. And it's also a very long-lasting result. So not only do you see the results instantly, all of these photos are taken only 30 minutes apart, but these results are very long-lasting. So yeah, Dr. Lee, I think we can go back to the previous slide and just let people scan the QR code as we take questions.